My name's Marsha Seymour, and I'm from Kingwood, West Virginia. I've been a teacher for over 30 years. I work for Preston County Schools. I am a long-term substitute. Last year, I taught special education for English, 9th and 12th graders. My ankle pain really caused a lot of limitations for me. It was really about 5 years ago when it really started a downward spiral. I just become a grandmother and I wanted to be able to do fun things with my grandkids, and I just kept seeing my mobility kind of slowly slip away from me, and I decided it was time I needed to do something about it. I wasn't ready to be in a wheelchair for the rest of my life, and so I decided that I needed to get help and see what could be done to make my ankle better. The first time I met Dr. Mahdi, when he walked in the room, I just knew everything was going to be better. He has the best bedside manner of probably just about any doctor I've been to. He just put me at ease right away, and I just knew that he was going to be able to help me. He answered every single one of my questions. He basically calmed all my fears because he has the skill and the knowledge to be able to do that. He said eventually down the road, I should look at maybe ankle replacement surgery, but of course everything else is done prior to that, and surgery is kind of a last resort. I had, done the physical therapy, I had worn the brace, and none of those were going to give me the pain-free experience I really wanted to have. And so he suggested that maybe it was time for me to look at ankle replacement surgery. And so that's what we did. To diagnose me, he took a lot of x-rays. He explained all the x-rays to me, because a lot of times when you're looking at the x-rays, you don't have a clue what they mean. And he explained everything perfectly to my satisfaction. And he said, basically, here's what I would need to do to replace your ankle. This is what your recovery time would look like. This is what your physical therapy would look like. He basically answered every question I had, and he laid out a really clear plan of what it was going to take to get me where I wanted to be. So the first time I had to walk after the surgery, after the 6 weeks was up, he was in there with me and he's like, okay, go ahead and put weight on it. And I was totally afraid to put weight on it. I was like, I don't know, cause for, so long I hadn't been able to. And then for 6 weeks, I hadn't been able to put any weight on it. And he just kind of held my hand and was there like, okay, put some weight on it, put some weight on it. And I did. And it was just miraculous that I could actually do this. And there was no pain, and my anxiety just lifted after that, and I knew that I was on the road to recovery. In my classroom, I have a high chair, kind of like the one I'm sitting in, and I would limp straight up from my desk up to the front of the classroom, and I'd sit in my chair. And my students knew that that was where I was pretty much going to stay. If they had questions, they pretty much had to bring their book or their tablet up to me. Now I can walk around. I can go from desk to desk. Someone raises their hand, I can go to them instead of calling them up to me. So it's really helped me in my job and educating students, because I can be free to move about the classroom now exactly as I need to. If you're thinking about having an ankle replacement, you should definitely do it. And you should definitely do it at WVU Medicine hospitals. And you should definitely do it with Dr. Mahdi, because going into the surgery, when I closed my eyes before I went under for the surgery, I felt fearless. I know I had heard a lot of people were when I told them I was getting ankle replacement surgery, they seemed a little bit surprised, and they were like, oh, isn't that the worst surgery you can have for replacement? Isn't that the one that causes the most problems? Knowing Dr. Mahdi and how he explained everything to me, and just feeling confident in him as a surgeon, I didn't worry about it. I knew that I was going to be okay, and I was. I just feel like my ankle replacement surgery gave me my life back. I used to sit around feeling sorry for myself and watching my mobility slip away right before my eyes, and feeling like I'm helpless. There's nothing I can do about this. This is just how my life's going to pan out. And when I met Dr. Mahdi and he told me what he could do and how he could help me, it just gave me hope, and it made me feel like I can get my life back. I can be active again. I can do the things I want to do again. Like, my life's not over. And it's just made all the difference in the world.